don't know how many people we're going to have today, but it got pretty hectic yesterday, so we're going to try to take people in order.
Okay.
So everybody gets a chance to ask a question. So let's be polite.
Call Mary Cassiola. Call Holly. Hey, I'm not seeing Jane here, and I'm not sure if she's coming, so when they start this thing, I'm going to hit this button to get it started. But Mary needs to... I did, and then I deleted it, so that works. So whenever I go, I'm going to hit it about 5 minutes before they start, so you guys can get it taken in your end. But I won't be able to communicate because it's my phone. Yes. No. And I wouldn't be able to communicate. So yeah, just I want to let you know I'm. About 5 minutes before they start at 2 o'clock, or right before they start, I'm gonna hit it. Okay.
How are you? Good. Tired. Yeah. On edge. Myself out of my car after I saw you this morning. Good way to start the day.
It wasn't my fault.
It was not your fault. That was definitely my fault.
come in, I just wanted to say we are social distancing today. So please try to put about 5 or 6 feet between yourself and the next person over. We're also going to take the questions in a more orderly fashion. We're going to try to go from left to right this way. Because it got kind of heated yesterday and people were kind of pressing together. We just want to keep everything spread out and cool this time. All right?
We get along.
Oh, yeah. I mean,
It's not like Anchorman with tridents.
it'd be fun if it was.
Good, how are you doing? They got you shooting?
I always have to, one man band.
I actually applied for a job in Oregon as the photo editor at Oregon Public Radio. Yeah. Because that's where I get most of my news anyway, so.
Yeah, and that's a really good member station.
Yeah.
They produce a lot of good content.
What's up?
There's a few of them.
I applied for 5. I had 5.
Dean of
Clinical affairs.
I have no idea, but go check in that
GON.
both our laptop. It may be plugged in there.
Thank you.
All right. Bye.
Dr. Sherman was nice enough to talk to us at Channel 5 or outside the site, so.
Channel 5 yesterday.
We're everywhere.
Every time you have to mess with
You hate the stand or the cell phone?
the whole live streaming thing, yeah.
Oh, no, I mean, I just wondered how to do it.
Everybody else gets to make a grand entrance. Wait the last minute, boy.
I think it was Channel 5, so.
I'd rather hang out with the reporters.
Well, thank you for that.
As long as I'm not on a hot mic all the time.
Oh, yeah, right.
Wonderful.
Oh, really good. I knew you'd remember. So we're supposed to be social distancing. So, no, you're welcome. You're welcome.
Well, good afternoon. We are in a moment unlike any other that any of us have ever experienced. This community has not had an epidemic of this magnitude or this serious for nearly 150 years when yellow fever struck and devastated our community. We are taking this public event seriously, and every day we are taking numerous steps to mitigate the negative public health consequences. As part of that effort, I am declaring today a state of emergency in Shelby County as our efforts enter into a new phase. As you know, the health department has been closely monitoring the confirmed cases of the virus in Shelby County, investigating and notifying those who have had contact with those known to be infected, and coordinating our county's response. Today's report of now 10 total confirmed cases brings us to a new phase of this public health event. As you will hear shortly from our health department, these new cases and other data suggest that we are in community spread or in community transmission. This means that it will be even more critical to practice social distancing, to temporarily postpone large gatherings, and to take other steps as recommended by the CDC and the county health department. Additionally, this means that it is even more critical that we begin the process of long-term planning for how we will care for patients that develop severe cases and need intensive treatment. There is reason to believe that the number of patients with severe reactions could be relatively large. This emergency declaration is part of those preparatory efforts. This declaration will put our county in a position, in a posture to receive vital aid when it is available. This declaration will streamline the process for Shelby County to obtain equipment and supplies and make temporary appointments in response to this emergency or in an effort to aid patients. Finally, this declaration helps clear the way for us to establish and stand up emergency operations as needed to ensure the continuity of government operations. Director Jones, our Director of Shelby County Emergency Management and Homeland Security, is here to answer any questions related to the emergency declaration process. And as always, our Director of our Health Department, Elisa Haushalter, is here to talk about the recent cases, community spread, and other issues and questions that you may have. With that said, I'd invite Director Haushalter to the podium.
Thank you, Mayor Harrison. Thank you for your leadership. I will keep my comments brief again today as I did yesterday, in part because we have another community partner with us that's going to talk about drive-through testing after I'm complete. As Mayor Harris noted, as of late yesterday evening, we have notice of additional cases, so we are up to 10 cases in Shelby County. You will recall that one of the earlier cases, that is case number 3, is somebody who's a traveler. So if you look at the Tennessee Department of Health website, you may see some discrepancy between my announcement today and what you see on their site, because that case, while being treated here in Shelby County, will actually be counted elsewhere. But for the purposes of our investigations, it's important to note that that person was diagnosed here and has been here during the course of their illness. Additionally, the state of Tennessee is continuing to see the number of cases rise, with 98 cases statewide, and the majority of those still in the Middle Tennessee area between Davidson, Williamson, and Rutherford County. Currently, we have had 36 individuals that were approved for testing at the state lab, and we have a very small number that have not been run at this point, and anticipate those will be done shortly. And we are currently monitoring 81 individuals. Also, earlier this week, I indicated that we would no longer, as a health department, be monitoring individuals who travel. That's based on the recommendation of the state health department as well as the Centers for Disease Control. So from this point forward, numbers that you hear that are under monitoring will be individuals who either quarantined or isolated or identified as a contact to a known case. I want to reinforce what Mayor Harris said is based on our investigations thus far. We believe that we're seeing the very beginnings of community transmission. So today is significant in part because of the declaration that the mayor has made, but also this is a pivotal moment in the epidemic, and we really need everyone to lean in, to use a euphemism, but we need everyone to lean in and do what they can to reduce transmission. That comes from employers who need to look at alternate ways to allow people to work from home or potentially change their operations to reduce contact, to individuals who can make decisions about not going to a restaurant or not going to a place where there's more than 10 people. I believe fundamentally and collectively that we can reduce the impact in our community, and we'll continue to rely heavily on our partners, as well as those in the media to get the message out. As we did yesterday, we want to highlight one of our partners. Many people are coming up with creative ideas independent of public health or other entities to see what they can do to impact COVID in our community. And one of those is the University of Tennessee Health Science Center, and particularly their medical school. And they have been working for weeks with not only the health department but the city of Memphis to look at how they can do expedited or drive-through testing. So I'm going to turn it over to Dr. McCullers, who's going to talk about their efforts to improve access to testing.
Great. Well, thank you, Dr. Haushalter. I appreciate the invitation to come out and speak a little bit at the press conference today and highlight some of the work that we're trying to get in motion right now. So as you know, ever since this pandemic started, UTHSC has been very engaged trying to put information out there, both in terms of our website and engaging with the media and providing expert advice to our partners and to others in the community that wish to have it. One of the most common questions we've gotten asked over the last few weeks has been about testing and about the problems that we've had really establishing large-scale testing in across the nation, but also in our local community, and the importance of that testing if we want to really understand the scope of the disease. So we've been rather patiently following this and watching how it's developed. And over the last week, it became apparent that even with the advent of commercial testing available at some of the local hospitals, that this really wasn't going to be sufficient to fill the need and fill the gap. So over the weekend, we determined that we thought UTHSC was probably the group that could step into that void and really provide some leadership as well as provide some expertise in that. So we got together with a number of our partners, with the city, with the county, with the state, and very rapidly put into place a plan to start to provide testing more broadly in the community. So in its first form, that is taking place today, is a setup of a drive-through testing facility. This is going to be in Tiger Lane over at the Memphis Fairgrounds. We have a couple of tents set up there today, and today we're conducting training with a number of volunteers, both from the city and from the medical school. A lot of our medical students are participating in this as volunteers. We hope within the next day or two to be able to start offering testing to the community. At the beginning, this will be by appointment only, and it will come from providers who have seen patients who need testing because they have had appropriate exposure or appropriate disease symptoms. They can then be referred to us, and we can accommodate them with testing in this drive-through facility. How the facility will work is we're going to have several stations. If people are referred there and have an appointment, they can show up. They'll be accessioned and put into our system at that time. They can then go to a second station where their information will be collected, their ID will be checked, those sort of things to make sure it's the right person and being tested for the right reason. And then they'll go into a further staging area where we'll be able to take samples from them and send those samples off for testing. For the first week or so of this, we're also going to be utilizing commercial testing, as are many of the partners in the community. We hope within about 10 days to be able to do local testing here at UT. This testing will really enable us to do this at a very large scale and with a very rapid turnaround time. One of the issues with commercial testing right now is that there really just isn't enough of it. It's really hard to get, and really the companies that are doing it are being overwhelmed with all the response from across the nation. So when you're able to get a response, it's often 5 or 6 days after sending the test out. And that's not very useful for making decisions about diagnosis or treatment or contact tracing, those sort of things that we want to do. So we hope that when we have testing available in-house, it's going to be very large scale. It's going to be with very rapid turnaround time that's really going to help our physicians in the community. As we go forward with the cooperation of the city and the county, we hope to expand this to some further sites. Those are really under planning stage right now, and so I don't have anything more definitive to say about that. So I appreciate you letting me have a brief moment just to talk about this, and I'm happy to answer questions with Dr. Haushalter as we need them.
We're going to open it up for questions, and Joan is going to help me monitor to make sure everybody has equal opportunity to get their questions heard. So questions really of any of us up here?
Can you say more about the new cases, or like
Did someone come visit them? Did they go out of state or?
So there's, we received multiple test results yesterday evening, and there's a variety of things. The majority of them are associated with travel, and they are not associated with our previous cases, with the exception of one individual that we haven't been able to determine the history of travel or exposure, which is why we're saying there's the early indications of community transmission. Now that we have 10 cases, we'll be able to start posting on our website the age ranges. Previously, we haven't released ages because our numbers are so small, but we'll begin to release the age ranges so people have a better sense of what age category is being impacted.
And again, do we know if some of the people know each other or not in this latest case?
Not in the latest ones. We absolutely know they don't know each other and aren't connected. The early ones were.
How about hospitalization?
The majority are not hospitalized currently.
And can you tell us a little bit, there seems to be an issue and concern that there isn't a way to know how much private testing has been done. Can you lay that to rest for us, why it matters, why it doesn't matter?
Well, first is we don't necessarily know how much private testing is done because the way the state law is written, that a laboratory only needs to report positive results to the local health department and the state health department. However, the Tennessee Department of Health is asking commercial labs to voluntarily submit to the state how many they have processed, and that's very beginnings of stages. So there might be some glitches in the data, but they're attempting to get that data, and the reason that's important is to look at positivity rates. So many people have looked at South Korea and how many tests they ran, but only 4% of those were positive because they were doing mass screening and not using the resources wisely.
A lot of the bars are still open. Are you guys going to get to a point where you're going to mandate them to shut down?
So I'm not going to necessarily mandate that. What will happen is we will give recommendations to the mayor around any policy interventions that might help this, but ultimately that's a decision of the mayor.
Why are you not recommending if there might be indication of community spread?
Because there's only beginning indications currently. If we have more community spread, depending on the age group, and we also look at, we can use GIS mapping to tell where people have been to see if there's really a linkage to restaurants and bars, and that's not necessarily the case currently.
Alicia, I know you may talk about this, or the mayor or someone else. Can you talk about the disaster or emergency declaration and what that actually does? Does it allow the county to start funneling money from places to other places? How does it impact us operationally?
So I'm actually going to ask Director Jones to speak to that because she has more expertise in that area.
The federal declaration actually allows us to apply for federal funding to address this issue of COVID-19 it can address mass care, any type of issue to help us to eradicate Shelby County from COVID-19. We can ask for federal funding for that.
Dr. Haushalter, if I'm correct, it looks like 80% of our confirmed cases in Shelby County were processed by private labs. Please correct me if I'm wrong. If that's the case, does that say something about the adequacy or inadequacy of the level of state testing? And then, yeah, what does that say about the level of state testing?
So I actually have to go back and calculate because it's
8 out of 10?
yeah, but that's still the majority of ours were actually done. I'm trying to count my numbers as I speak to you. I would double check because we've had more than 2 that were processed in state lab. The majority of those were state lab, and the more recent ones were private labs. So I'll calculate the numbers and get back to you because I don't want to give you misinformation.
Okay.
I will say
because I know we had the 4, and the first 2 were, I believe, done in the public lab, and then the next 2 were private, and then the 6 that came in last night.
they weren't all from private labs yesterday, and I didn't state that, so I don't want to give you misinformation. What I've said before, and I'll continue to say, for individuals who have needed testing in Shelby County, we have been able to access testing.
Will you be testing, now that we have more testing available with all the commercial labs in UCHSC, will you be testing all the individuals in isolation or
No.
quarantine?
No,
Why not?
because it's not warranted for individuals that are in quarantine until they become ill. And that's the CDC guidelines, and that's the recommendation we've made to healthcare systems is to adhere to the CDC guidance around who should be tested and when they should be tested.
Dr. Haushalter.
I'm going to go over, is there anybody else over here? I'm trying to go from one side to another. You haven't had a chance yet.
Thank you. If
Today is the initial declaration of community spread. How does mitigation change if there will be no mandates of certain places closing? How does that change?
Well, what we are hoping will change is that people will actually heed the message that's been given really since January of not to engage in any non-essential travel, to avoid places where we know there's transmission, to avoid crowds of more than 10 people, and to, as much as possible, engage in social distancing. So ideally, it'll serve as a reminder to the public that this is impacting our community, it's continuing to spread, and that we all have a part to play to reduce the impact on our community.
So after your press conference yesterday, you had 6 more confirmed cases.
Yes.
Do you have any idea of how many test results we are looking for? Because potentially 24 hours from now, we could again be announcing confirmation of multiple cases. What are we
Exactly,
waiting?
and I don't
How
have the
many?
exact numbers. We have a few that are waiting at the state lab, but I don't know what's pending at commercial labs.
Could you talk about the, your hotline that the health department has for COVID-19? We've heard from folks that they have had trouble trying to get into that, and they called the state, they're having trouble there. How many folks are working at? Is it overwhelmed? Do you have enough folks to answer the phone?
So I won't say it's overwhelmed. We have somewhere between 4 and 6 people every day, 7 days a week. If a call comes in and someone is not able to answer it immediately, it does go to a message and they're able to respond back. We are receiving over 100 calls a day, a little bit less on the weekend. Some of the frustration that's been expressed to me is people are calling because they want to be tested, and we're not able to provide that testing, but they also don't meet the criteria for testing, and so that's been frustrating for individuals. So I want to reinforce what was said earlier by Dr. McCullers. There are certain people who need testing, not the mass public. And so those individuals are encouraged to seek advice from their healthcare provider, not necessarily through the hotline.
It's still CDC guidance that they are symptomatic to be tested, right?
Yes.
And Dr. we had heard that the Air National Guard, and I'm not sure if you've already addressed this, might be bringing in or shipping in test kits for Memphis. Is that the case? Can you tell us anything about that? What's the status?
So that, I would say, is partially true. What we've received notice of, and we'll have more information later this afternoon, is that a portion of the national stockpile will be delivered to Memphis at some point in the upcoming days. However, at this point, we don't know what is in that particular stockpile. So it may be limited to personal protective equipment, and it may or may not have test kits.
What would be ideal for you?
Well, I think it's really what's ideal for the community, and the combination of PPE and test kits would be beneficial to the community.
Can you confirm whether the case number 3, is that person from Mississippi, the recent travels of that person?
No. Case number 3 is someone that is from outside the United States that's traveled since January through March. They arrived here on the beginning of March and was ill the day they arrived and have been isolated since.
Are there any other broader travel details we know about these most recent 6 cases?
Not at the current time. I'm going to take one more question and we'll wrap up.
Yeah, Mayor Harris, if I get this correct, said a relatively large number of people we believe are going to require hospitalization. What's a relatively large number of people in Shelby County, and our hospital is going to be equipped to handle a relatively large number?
So relatively large number, it really goes by the population that we have that are older and are more at risk. We know they're more likely to be hospitalized. We don't necessarily have good prevalence data on the number of people who have chronic illnesses. We can make some estimates, but we know there are a significant number of people here that have diabetes, heart disease, and other illnesses that are more likely to require hospitalization. There is a process in place that many people are not aware of. Each region in the state has what's called a regional hospital coordinator, and that's existed since shortly after 911, where the hospitals actually feed into a data system every day their bed availability. Now they're adding their PPE availability. They can even put in test availability, so that if there's beginning to be a surge, that can be picked up quickly, and then the hospital systems work with each other to make adjustments or to request help from outside. So that system's been in place. It works well. We also do something called syndromic surveillance, which is where we monitor emergency room visits, the number of visits and the percentage of those that have flu-like illness, so that we can predict early if there's a surge and notify our hospital and healthcare systems. But actually, I'm going to defer the end of that to Dr. McCullers, because he may speak specifically to UT's preparation, if you want, and then we'll wrap up from there.
But do you have any sort of number you could give us as to how many people in Shelby County might need to be hospitalized?
I don't have a number off the top of my head.
Can you say if any of them were MPD officers that were exposed, or any public safety workers that were exposed?
There are no public safety workers that are identified as cases.
And Dr. McCullers, can you share, I know you talked about in the coming days, I know it was a fluid process. For those wondering in the community, when will there be an online link people can go to in the next couple of days to figure out the registration, et cetera?
Yeah, so to address the question over here, the hospitals are all preparing very, seriously for this, and doing things like, conserving PPE and counting the number of ventilators and counting the number of beds, cutting down on elective surgeries, trying to have early discharges, trying to make space for patients. We really don't have a good idea yet of how bad this might get in Memphis. We have some examples from northern Italy and from Seattle, and now starting in New York City and state that we can draw on. And so we're trying to prepare for the worst possible and hoping it's much better than that because of some of the efforts that have been taken. In terms of the question about when are we really going to be ready to go, I think by the end of the day today, and please nobody go out there today yet. We're not up and running yet. We should have our processes in place. The issue really becomes then, how many people can we test? How many test kits can we put together? So we're not getting these test kits from the government. We're actually building these ourselves. We have the expertise and ability to do that. And there's some supply issues. So we're having trouble getting the swabs right now. So if you can't swab somebody, you can't run a test, right? So as we get those things solved, we'll be able to see more and more, and we'll be able to kind of let the public know when doctors can start sending patients to us.
And there's a lot of talk nationally from the CDC about hospitals running out of masks, using homemade masks. And talking to the Baptist Methodists, are we getting a sense of this? Are there shortages in our local hospitals? Are we thinking about tents and things like that, worst case scenario?
We're not seeing shortages yet in the local hospitals. We are seeing concern about the possibility of shortages. So a lot of things are being done to conserve the PPE. So today over at Le Bonheur, which I'm most familiar with, obviously, we changed the policy to where nobody's going to wear the N95 mask, the most rare ones, unless they're doing aerosol generating procedures within the hospital. So we're going to stop use of those and see them only for that specific instance.
I want to interject here.
Sure.
So we're going to end questions. What I want to do is give Director Jones an opportunity to make a few other comments, and then the mayor, if he chooses to make our ending comments, and then we'll close.
In regards to federal funding, we have been approved for public assistance, which means they will assist Shelby County government while addressing the COVID-19 outbreak. Also, funding is going to be available for small businesses through the federal government as well through FEMA. And I also just received information from FEMA that funding will be available for aging and the disabled population. Funding will be available for groceries and household items for those individuals.
Thank you. Mayor, did you want to make any comments?
Can you reiterate, Mayor, the call for the declaration again, the importance of this and why?
So sure, I will. So the declaration really is going to help us in a few target areas. For one, it puts us in a posture to be prepared if there is federal or state resources that become available. In addition to that, it allows us to streamline the purchasing process if we need equipment and other supplies to render life-saving aid and also to support and help patients and victims. In addition to that, it also gives us the power to set up emergency operations should the need arise and to make temporary appointments as we see fit. I was only going to say, in addition to that, there is a lot of investment and effort to promote coordination among the municipalities. We have 7 municipalities in Shelby County. We will have a meeting of some of the leaders of those municipalities this evening. It won't be the first meeting of the leaders of those municipalities even today. But we'll again come together, convene to talk about how we can collectively mitigate the public health event that we're currently experiencing. And some of those conversations will lead to questions around the gatherings and how we might slow the gatherings in Shelby County.
Mayor, a lot of people are fired up right now on Twitter. They're asking, why didn't we learn from New York City? Why didn't we learn from Italy? Why are we taking this risk? Why don't we just close these red bars and restaurants and not take any chances? What would be your response to that?
Well, I think we are looking at all options in order to respond effectively to this public health event. I think the issue is to avoid panic and to make sure all the decisions that we take are informed and based on science and the best advice from our health department and our CDC guidelines. So we can inflame panic if we take decisions to make closures that won't have any positive benefit for our public health. So every time we take a decision, we want to make sure that it's grounded in science and actually is going to improve outcomes and mitigate the number of people that actually are exposed to the novel coronavirus.
So we're going to end questions. I appreciate everyone coming, and I really appreciate the mayor taking time to be here, as well as Dr. McCullers, and we'll see you here tomorrow at 2.
And Mayor, could you talk to us about golf real quick?